Hello, this is Dr. Suprim Sadhukhan practicing at the Boidavati endocrine disorder, diabetes, thyroid, and hypertension. Now I will start my talk on latest update on hypertension. As per WHO, nearly 63% of the total deaths in India are due to non-communicable disease, of which 27% are attributed to CVD, which affects 45% people in the 40 to 69 years of age group. Raised blood pressure is among the most important risk factor for CVD. Moreover, it remains poorly controlled due to low awareness and hypertension, lack of appropriate care through primary care, and poor follow-up. In India, the prevalence has also gone up over 30 years to 38% in men and 32% in women, from 29% and 28% respectively. Despite that, nearly half of the people, or 51% of the men and 41% of women with hypertension, were unaware of the condition. Additionally, over 62% of the men and more than 53% of women living in the hypertension didn't get the treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide. International Society of Hypertension has released that ISH 2020 Global Hypertension Practice Guideline. The inclusion of the optimal and essential treatment refers to evidence-based standard care, and whereas essential standard refer to minimum standards of care to allow specification of essential standards of care for low resource settings. AHASCC has released scientific statement in 2021 offering new guidance for management of stage 1 hypertension among patients with low CVD risk. Among low procedure 130 to 139 and 80 to 89, management starts with non-pharmacological therapy. If blood pressure remains uncontrolled at 3 to 6 months, consider starting pharmacological therapy. Acute respiratory distress syndrome is potentially fatal condition involving lung damage, and experts often associate with it severe COVID-19. A recent study which appears in the Journal of American College of Cardiology reports that metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19 induces ARDS. Lowering systolic blood pressure target zones is 110 to less than 130 range substantially reduce the severe adverse event in step randomized trial, affirming that the Suprim's finding of an older Chinese population among some 8,500 patients ages 60 to 80 in China, an intensive target trimmed to 26% of the composite CV risk. Findings from now a second major trial supporting a lower target could unite the guidelines, which even among US professional societies ranges from threshold to 130 to 150. With regard to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European Guidelines of the Management of Arterial Hypertension recommend that diagnosis of hypertension should not only be dependent on office BP measurement and also on out-of-office measurement such as ABPM or home blood pressure monitoring (HBPM). 24 hours and nighttime BP measurement were associated with greater risk of mortality and composite of CV outcome. Thus, they may be considered as the most relevant measurement for estimating CV risk. For every 20 to 10 mm of mercury increment of BP measured at night, the risk of mortality increased by 23%, risk of cardiovascular event by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal BP control. The 2018 European guideline actually recommend that classes of antihypertensive drugs considering high non-adherence treatment. The importance of combination treatment is particularly highlighted to improve adherence to therapy and BP control. Therefore, 2018 European guideline recommends, especially in the context of lower BP target, to start antihypertensive therapy with an initial dual fixed dose combination ACEI or ARB and CCB and diuretics. Since early July 2018, product containing valsartan has also been recalled worldwide. The reason is the detection of unknown carcinogen, namely N-nitroso dimethylamine (NDMA), which can be found in candesartan, irbesartan, losartan, olmesartan, valsartan. NDMA has been classified by the WHO International Agency for Research of Cancer to carcinogenic in humans. If 1 lakh patient would have received NDMA contaminated valsartan from Jingbai Husai manufacturing site where the highest level of contaminations were found every day for 6 years in the highest dose, it could be result 22 additional liver cancer over the lifetime of this patient. The presence of NDMA in these two drugs could lead to 8 additional cancers in 1 lakh patient if they had taken highest daily dose over 4 years. Valsartan recalls accompanied by a significant increase in the rate of emergency department visit. The HYGEA study represents that largest study of the tested nighttime antihypertensive treatment. In this trial, chronotherapy was associated with significant reduction in endpoint including death. HYGEA chronotherapy trial tested whether nighttime therapy in comparison to usual upon awakening hypertension therapy exerts in a favorable CVDs reduction. The largest study included a total 19,084 hypertensive patients. During an average follow-up of 6.3 years, 1,752 participants experienced the primary CV outcome. Ambulatory BP measurement was performed for 48 hours to collect data on how BP differed during sleep. The reduction for CV events was significantly improved for nighttime treatment was when compared with awakening treatment. Thank you.